Hello everyone, I am Dr. Gitto and today I'm going to give you a brief description of the medical legal system in Italy. The Italian medical legal system is very complicated and it is not easy to explain it in detail. So after a brief general description, I will focus on the forensic pathology part. So in Italy, forensic pathology is a part of a broader area called legal medicine. And legal medicine is the branch of medicine that deals with the application of medical knowledge to legal problems and legal proceedings. In several countries, the terms legal medicine and forensic medicine have the same meaning. The physician who completes the residency program in legal medicine becomes medico-legale, which means medical legal expert, and also means that he is a specialist in legal medicine. So in Italy, legal medicine is a discipline which includes numerous subdisciplines. Some of these the main disciplines are forensic pathology, clinical forensic medicine, bioethics, social security and social benefits, insurance medicine, and others. Regarding the insurance medicines, this is a large area of legal medicine in Italy, and it deals with the evaluation of body injuries on behalf of insurance companies. So let's talk about the forensic pathologist in Italy. The forensic pathologist in Italy has a medical degree and has completed a specific residency program in legal medicine that is a 4 years residency program. The forensic pathologist does not have a specific training in general pathology because the main pathology topics needed for the professions are covered during the residency. And usually, the forensic pathologist in Italy comes from a university institute or from a private company or belongs to the scientific police. So this slide shows the main area in which the forensic pathology is involved. The most important area is the medical legal death investigation that includes the crime scene investigation, the autopsy examination of violent deaths, sudden deaths, deaths in the hospital, death in custody, medical malpractice, and others. The second main area is the clinical forensic medicine that deals with evaluation, usually on living subjects. So this can be the evaluation of cases of child sexual abuse, child maltreatment, torture, interpersonal violence, or other similar topic. And then the forensic pathologist is also required to go on court for court deposition. Now let's talk about the autopsy legislation in Italy. So autopsies in Italy are performed under two main statutes. The first one is the judicial autopsies that are requested by the prosecutor to provide answers about the victim's identity, cause of death, time of death, and other questions to help the law enforcement agency solve the crime. The judicial autopsies are performed by forensic pathologists. The other statute is the hospital or national health service autopsies that are called riscontri diagnostici. And basically, these are clinical autopsies that are carried out in the hospital to determine or confirm the diagnosis of the disease which caused the death, or in cases of death that occurred without medical history or without an attending physician when no crime is suspected. This type of autopsies are performed by forensic pathologists or general pathologists or other physicians. Now I will show you a summary of the steps required in a case of a judicial autopsy. So in Italy, forensic cases are handled by the Pubblico Ministero, which is the prosecutor, who takes the judicial initiative following the so-called notizia di reato, that literally means notification of a crime. The notification of a crime can come from anyone, so judicial police, cops, citizen, doctors, etc. Once the prosecutor receives the notizia di reato, he transcribes it in a specific registry at the prosecutor office and starts the investigation. If the notification concerns a violent death, a sudden death, or a suspicious death, meaning a death that is unexpected and its circumstances or cause are medically or legally unexplained, the forensic pathologist is called by the prosecutor to collaborate with the case as an expert consultant. So the forensic pathologist usually works in a specific section of legal medicine of university institutes, and these offices have the morgue and all the necessary services to perform a comprehensive medical legal death investigation. So usually these offices have toxicology lab, histology lab, genetic lab, and others. The next step is filling and signing out the so-called conferimento dell'incarico, that literally means assignment of the case. This is a document which contains specific questions made by the prosecutor to the forensic pathologist. In the white box, you can see the standard questions that are usually asked in a typical judicial autopsy case. So the question concerns the time of death, cause of death, manner of death, mechanisms of death, and also any other useful information that the expert thinks might be helpful to the prosecutor. The forensic pathologist then conducts all the necessary investigations to answer the prosecutor's questions, including the crime scene investigation, external examination, autopsy, samples collection for additional studies, and others. At the end of his investigations, the forensic pathologist must write a final report which must contain an in-depth discussion of all the results and findings related to the case. So the Italian autopsy report is very different from the one that you can see in the United States. Usually an Italian autopsy report is between 10 and 30 pages, but it can be also much longer, especially in cases of medical malpractice. After the investigations are concluded, the prosecutor receives all the investigative reports, including the autopsy report. So usually there are multiple reports because more than one expert can be called to collaborate with the same case. Based on the evidence, the prosecutor can decide for a non-suit judgment, a request for a trial, or he can also ask further questions to the forensic pathologist if the autopsy report was not clear or exhaustive. So this was a very brief overview of the Italian medical legal system with special regard to the forensic pathology part. So I want to thank you for your attention. These are some references that you can check if you are interested in this topic. So thank you again and stay safe.